Hi, I'm Dr. Charlotte Charfen, board-certified emergency medicine physician, working on the front lines, but here to talk to you about telemedicine, what it is, why you should care, and maybe actually think about utilizing it. So telemedicine is the use of technology between a healthcare provider and their client to communicate. Simple as that. That helps the healthcare provider evaluate the patient, treat the patient, diagnose. It's usually done through a computer, right? Through a computer program or through a smartphone application. And it's actually been around for years. I've used it inside the emergency department and with my private patients for a very long time. But because of this pandemic, people are really starting to hear about it. And I think that's one of the biggest benefits is that by using telemedicine, we can absolutely decrease the spread of COVID and other infectious diseases. The other thing that I think telemedicine really helps do is it conserves our hospital resources. If you know anything about our healthcare system, it's broken, and a lot of people don't have doctors, or even if they do, they can't get in to see them. And so the emergency department becomes the catch-all. As an emergency physician, I see it every time I walk into the emergency department. We're treating a lot of primary care because people don't have access. So telemedicine gives access and it conserves those very important hospital resources that I think we're all now seeing are not limitless. The other thing telemedicine does is provides extreme convenience. There is no waiting in a waiting room surrounded by sick people. You're not getting in your car and having to drive and waste that kind of time, right? The other thing is it's typically inexpensive. So for me, example, a 15-minute visit, $75. Some people's insurance cover it. Some health plans actually offer it as an option. So you can get a really valuable evaluation for not a lot of money. And I think that's really important. A couple of things I do want to point out about telemedicine is that it's actually regulated by each state. So every state has its own laws around how telemedicine can be used. And I think that's one of the reasons a lot of doctors have not utilized it as much is because some states make it really difficult. Also in the past, insurance companies have not reimbursed for it. So let's be real, doctors aren't going to do it just for free, right? So that's changing. This pandemic has actually changed that a lot. The states, a lot of the states I've watched have dropped a lot of the silly regulations, and there's been a lot more reimbursement talk. And I think what's going to also happen is you're going to see a big change in the laws as this pandemic, even after it passes. The other thing I want to make sure people understand when they are using telemedicine is something called HIPAA compliance. It's a law that's mandated by the federal government that we as clinicians protect your private information. That's why you can't just use any kind of video. So FaceTime is not HIPAA compliant. Skype, not HIPAA compliant. Zoom says it is, but we've seen it get hacked, so I don't use Zoom. So anytime you're using telemedicine, make sure your doctor is using a HIPAA compliant platform. There's so many out there. They're pretty cost effective and easy to come by. So that's just something to keep in mind. Some examples of things you would actually use telemedicine for, right? Not everything can be taken care of with telemedicine, but there's a lot. So basic exams, follow up with your doctors. The way I tend to use it I see a lot of people through urgent type that need urgent things. So, but simple, like throat infection, ear infection. They know they have a urinary tract infection. They just know they need an antibiotic, and it's very simple to use the video to see that they're not sick. The other thing are medication refills. People that have blood pressure, cholesterol, asthma, and they're doing fine, but they need their medications refilled and they don't want to go sit in their doctor's office to get that done. Beautiful use of telemedicine. Things you don't want to be using telemedicine for are your emergency type situations. So chest pain, shortness of breath, severe pain anywhere, but like in your abdomen or your head, any kind of neurological symptoms, those are all reasons to go to an emergency department, even call 911. So you don't want to go there with telemedicine, but your basic simple things, telemedicine's beautiful for actually covering. And so what I would suggest is that you actually talk to your doctor. Start there if you have one. Ask the office, are you guys using telemedicine? And if they're not, maybe encourage them to do that. If you want to work with me, you can. I've opened my practice up to people that live in the states of Hawaii, Florida, Georgia, Texas. That's where I'm licensed right now. So my practice, that's easy to get into, drchacha.com, drchacha.com. Also, if you're not within my state, but you still want to use telemedicine and you don't have a doctor, there's a lot of national platforms out there too. So there's a lot of ways that telemedicine can be utilized, and I would highly encourage doing so if the need arises for you. Stay safe, stay well, and have a beautiful day.